If you're out of the loop on the new study that showed women are 66% less likely to die from breast cancer, go and put the kettle on and I'll fill you in. I'm Dr. Liz O'Riordan. I'm a breast surgeon who's had breast cancer and I do the research so you don't have to. A study published in the British Journal of Medicine today found that women diagnosed with early breast cancer are 66% less likely to die within the first 5 years after their diagnosis than women treated 20 years ago. It was published by Professor Carolyn Taylor and colleagues and part funded by CRUK, the University of Oxford and the NIHR Biomedical Research Centre. So what was the aim of the study? They wanted to provide information for clinicians to use when estimating breast cancer mortality risks for patients diagnosed today. In simple terms, that means what is the chance that a woman will die because of her breast cancer? So how do they do it? Well, they looked at every woman diagnosed with early breast cancer, over 500,000 of them between 1993 and 2015, and followed them up to December 2020. They didn't include women who had neoadjuvant treatment like chemotherapy before surgery, women who had more than one cancer, and women whose cancer had already spread. What did they find? For all women, regardless of cancer type or size, they showed that the highest risk of dying from breast cancer is in the first 3 years. This risk then decreases over the following years. Now, if we just look at the first 5 years following diagnosis, when the risk of dying is at its highest, women diagnosed between 1993 and 1999 had a nearly 15% chance of dying in the first 5 years, whereas women diagnosed between 2010 and 2015, that risk fell dramatically to 4.9%. But that 4.9% risk of dying doesn't apply for every woman diagnosed today. There are lots of factors that can affect that risk, such as tumour size, lymph nodes, or a woman's age. The actual risk of dying for the women diagnosed between 2010 and 2015 had a really wide range. 2/3 of the women had a less than 3% chance of dying in the first 5 years, and 9 in 10 women had a less than 10% chance of dying in the first 5 years. But 1 in 20 women, or 5%, had a 20% risk of death, so there is still much work to do. If you like what you've seen so far, make sure you hit the subscribe button so you don't miss my next video. Now you may be thinking, what about receptor status? Well, HER2 receptor data was only available for women diagnosed after 2010. Women who were HER2 positive actually had a lower risk of dying in the first 5 years than women who were HER2 negative, and that's regardless of estrogen receptor status. And this must be due to the huge success of targeted treatments like Herceptin. Estrogen receptor data was available for all the women, and overall, women with ER negative disease had a higher risk of dying in the first 3 years when compared with women who were ER positive. However, this reversed when they looked at the 10-year survival data, when the women with ER positive cancers had a greater chance of recurrence than the ER negative group. Now, considering all the calendar groups, women diagnosed at every single stage of the year, breast cancer mortality rates, so the risk of dying from breast cancer, peaked during the 3rd year after diagnosis for every group, but it was a much higher rate for ER negative disease. What about age? So the risk of death in the first 5 years was lowest for women in their 40s at diagnosis and highest for women in their 80s when they are diagnosed. However, women diagnosed under the age of 40 did have a higher risk of recurrence. And we know that young women, for whatever reason we still don't know, often have more aggressive disease. Were there any other surprises? Well, yes, actually. The number of women diagnosed with breast cancer has dramatically increased over the last 20 years. From 1993 to 1999, 16,000 women were diagnosed, but in 2010 to 2015, an extra 10,000 women developed breast cancer, taking the number up to 26,000. This may be partly due to an extension of the screening age. Before 2005, only women aged 50 to 64 were eligible for screening. But it's also important to consider that the hormonal changes arising from obesity, heavy drinking, and the increasing use of HRT may have also had an impact. So what does this mean for you? Well, I think it's great news for anyone diagnosed today that the risk of dying from breast cancer has dramatically fallen since the 1990s, although that risk is still considerable for a small number of patients. Women with large, high-grade, node-positive tumours will still have a greater chance of recurrence than those with small, node-negative, low-grade cancers. But the introduction of new chemotherapy drugs, targeted therapies like Herceptin and CDK inhibitors, PARP inhibitors for BRCA cancers, improved radiotherapy protocols and surgical techniques should mean that the survival rate continues to increase. Now, it's important to remember that when your doctor gives you your prognosis of being alive in 10 years' time, it is based on data that is at least 10 years old. And as this study has shown, that is the worst case scenario. Things can only get better. Now, I have 3 final thoughts, and the first is, what about the men? Now, I understand why men weren't included. For a population study of this size, you need huge numbers of patients to be able to show a statistical difference in survival. Male breast cancer is rare, but that doesn't mean that men aren't interested in knowing whether their odds for survival is improving. I would love to see that data. Secondly, the study didn't have access to all the data about recurrences, and this is simply because it doesn't have to be collected. There is no national database that has to be filled in for metastatic cancer, and that needs to change. 31 women and men die every day, and we need to know everything about their disease so we can learn from them to change the future. And finally, if you have breast cancer, it's important to remember that it can come back in the future, even in 30 years' time, especially if your cancer is ER positive. Make sure you know what the symptoms of recurrence are for your type of cancer, because ductal is different to lobular, and I'll be doing a video about that shortly. If you want to reduce your risk of a recurrence, exercise 5 times a week, cut your alcohol to no more than 5 units a week, and try to maintain a healthy weight for your height. I'm Dr. Liz Reardon. Thanks for watching my channel. Make sure you subscribe so you don't miss the latest breaking news about breast cancer. And if there's anything you want me to do a video about, let me know in the comments and I'll get on it for you.